It's a pleasure to be with you. The title of this session is Organization and Financing of Public Health, Part 4, CDC, Communicable Diseases. There are no disclosures for this presentation. Objectives include review the HIV/AIDS situation in the United States and globally. Review the hepatitis situation in the United States. Review the situation of sexually transmitted diseases in the United States. Review the tuberculosis situation in the United States. The CDC has 3 centers to prevent, detect, and control communicable diseases. The National Center for Immunization and Respiratory Diseases, NCIRD. National Center for Emerging and Zoonotic Infectious Diseases, NCHHSTP, and National Center for HIV/AIDS, Viral Hepatitis, Sexually Transmitted Infection, and Tuberculosis Prevention, NCHHSTP. In Part 3 of this series, we discussed the National Center for Immunization and Respiratory Diseases and National Center for Emerging and Zoonotic Infectious Diseases briefly. Let's use this session discussing key diseases addressed by the National Center for HIV/AIDS, Viral Hepatitis, Sexually Transmitted Infection, and Tuberculosis Prevention. As mentioned in Part 3, the National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention, NCHHSTP, is particularly interested in engaging young people through advancing school-based health and disease prevention programs, developing data and educational materials to support clinicians, and developing communication materials to support disease prevention among highly affected groups. During this session, you will hear that treatment is often listed as a key activity of a primary prevention strategy. Treatment is usually provided by clinicians and considered secondary, not primary prevention. Treatment of infected individuals may not only cure disease, secondary prevention, but also decrease a community's infectious pool, thereby reducing transmission, primary prevention. This linkage of clinical care to public health strategies is a good example of the integration of public health and primary care as recommended by the Institute of Medicine in 2012. Since the beginning of the HIV/AIDS epidemic in 1981, 85.6 million people have been infected with the HIV virus worldwide, and about 40.4 million have died. As of 2022, 39 million people were living with HIV. An estimated 0.7% of adults aged 15 to 49 years old worldwide are infected, although the disease burden varies considerably between countries and regions. The WHO Africa region is most severely affected, with nearly 1 in every 25 adults, 3.2%, infected with HIV, accounting for more than 2/3 of the people infected globally. At the end of 2019, an estimated 1.2 million people aged 13 and older had HIV in the United States, which includes an estimated 158,500, or 13%, with undiagnosed infection. In 2020, there were 18,489 deaths among adults and adolescents who were diagnosed with HIV in the United States, U.S. territories, and Compact of Free Association (COFA) countries. HIV risk factors vary widely depending on the type of exposure or behavior. Most commonly, people get or transmit HIV through anal or vaginal sex, or sharing needles, syringes, or other drug injection equipment, for example, drug cookers. HIV prevention measures include antiretroviral therapy, ART, for those infected. ART suppresses HIV virus in those infected, reducing the risk of transmission to HIV-negative partners. When taken regularly as prescribed and achieving and maintaining viral suppression, ART can reduce the risk of transmission to zero. Pre-exposure prophylaxis, PrEP, is medication taken by HIV-negative individuals to reduce the risk of acquiring HIV. When taken consistently, PrEP can reduce the risk of HIV infection by up to 99%. Of the 1.2 million people who would benefit by PrEP, only 30% were prescribed PrEP in 2021. There were marked racial ethnic differences for those who received PrEP. Black African American 11%, Hispanic Latino 21%, white 78%, other 12%. The CDC goal is to reach 50% by 2025. Post-exposure prophylaxis, PEP, is medication taken by HIV-negative individuals who may have been exposed to HIV within the past 72 hours. When taken within 72 hours of exposure, PEP can reduce the risk of HIV infection. Condoms are an effective barrier method that can reduce the risk of HIV transmission during sexual intercourse. When used correctly and consistently, condoms can reduce the risk of HIV infection by up to 80%. Low-risk sexual behaviors can also reduce the risk of HIV transmission, including oral sex versus intercourse. Prevention challenges include HIV stigma, homophobia, poverty, limited educational opportunities, racism and discrimination, and language barriers. Addressing these social and structural barriers and encouraging safe and supportive communities can help improve health outcomes for people with or at risk for getting HIV. Hepatitis is a viral liver infection. There are 6 main types of viral hepatitis: A, B, C, D, E, and G. We will focus our brief discussion on the 3 most common viruses causing hepatitis in the United States: A, B, and C. Hepatitis A is a vaccine-preventable liver infection caused by the hepatitis A virus, HAV. Though there was a decline in cases during the pandemic years of 2019 to 2020, hepatitis A cases currently remain 7 times higher in 2023 than in 2015. 84% of cases occur in the non-Hispanic white population. HAV is found in the feces and blood of infected people. Hepatitis A is highly contagious, usually spread through close personal contact with an infected person or through eating contaminated food or drink. Symptoms of hepatitis A can last up to 2 months and include fatigue, nausea, stomach pain, and jaundice, which can impact school attendance and work. Most people with hepatitis A fully recover. Vaccination is the best way to prevent hepatitis A. Hepatitis B is another vaccine-preventable liver infection caused by the hepatitis B virus, HBV. Hepatitis B is spread when blood, semen, or other body fluids from an infected person enters the body of a non-infected individual. Transmission commonly occurs through sexual contact, sharing needles, syringes, or other drug injection equipment, or during pregnancy or delivery, transmitting the infection to the baby. Not all people newly infected with HBV have symptoms, but for those that do, symptoms can include fatigue, poor appetite, stomach pain, nausea, and jaundice. For many people, hepatitis B is a short-term illness. For others, it can become a long-term chronic infection that can lead to serious, even life-threatening health issues like cirrhosis, liver disease, or liver cancer. Age when infected is associated with the risk of chronic hepatitis B. The younger a person is when infected, the greater the risk of chronic infection. Approximately 90% of infected infants and 33% of infected children less than 6 years old will develop lifelong chronic hepatitis. Most children over 6 years and adults infected with the hepatitis B virus recover completely and do not develop chronic hepatitis. There is no cure for chronic hepatitis B, though some antiviral and immunomodulator medications may reduce virus replication and reduce liver damage. Vaccination is the best prevention method for hepatitis B. Hepatitis B screening is important, especially for pregnant women. If positive, their babies should not only receive the hepatitis B vaccination, but also hepatitis B immune globulin, HBIG, after birth to prevent infection. HBIG and hepatitis B vaccine given within 12 hours of birth to the newborn of a woman who is hepatitis B antigen positive is 94% effective in preventing infection in the baby. Hepatitis C is caused by the hepatitis C virus, HCV. Hepatitis C is spread through contact with blood from an infected person. During 2020, rates of acute hepatitis C were highest among males, persons 20 to 39 years of age, American Indian Alaska Native persons, those who reported using injection drugs, and those living in the eastern and southeastern states. The U.S. new infection or incidence rate in 2020 was 40.7 per 100,000 people, which is a 124% increase since 2013. Most people become infected with the hepatitis C virus by sharing needles or other equipment used to prepare and inject drugs. For some people, hepatitis C is a short-term illness. But for over half of people who become infected with the hepatitis C virus will develop chronic infection. Chronic hepatitis C can result in liver cirrhosis and liver cancer. Hepatitis C infected individuals often have no symptoms, but when symptoms appear in chronically infected patients, they often have advanced liver disease. There is no vaccine for hepatitis C. The best prevention for hepatitis C is to avoid risky behaviors like injecting drugs. Getting tested for hepatitis C is important because antiviral treatments can cure most people with hepatitis C in 8 to 12 weeks. 4 of the most common sexually transmitted diseases are chlamydia, gonorrhea, syphilis, and human papillomavirus, HPV. Sexually transmitted diseases, STDs, impact millions of people in the United States, with the rates rising each year since 2014. From 2017 to 2021, reported STDs have increased by 7% in the U.S. STDs disproportionately affect those under 25 years old, racial and ethnic minority groups, and gay or bisexual men. From 2017 to 2021, chlamydia incidence decreased by 4%. Gonorrhea increased by 28%. Syphilis increased by 74%, with congenital syphilis increasing by 203%. The decrease in chlamydia rates from 2017 to 2021 was likely due to reduced screening during the COVID pandemic and not a reduction in new infections. In 2021, 51% of all reported cases of chlamydia, gonorrhea, and syphilis were among young people 15 to 24 years old. American Indians, Alaska Natives are second only to Black African Americans in rates per 100,000 for chlamydia and gonorrhea, and have the highest rates for syphilis and congenital syphilis. Many individuals with STDs are asymptomatic, but if left untreated, chlamydia, GC, and syphilis can result in chronic pelvic pain, pelvic inflammatory disease, infertility, severe pregnancy and newborn complications, and infant deaths. Chlamydia, gonorrhea, and syphilis can be treated. HPV vaccine covers most HPV viruses that cause cancer. HPV is primarily transmitted by sexual contact, with clinical presentations ranging from no symptoms to warts, laryngeal papillomas, and cancers in both females and males. Cancers include cervical, anal, penile, and oral. There are over 170 HPV serotypes. Each serotype is designated by a number. Some HPV serotypes, like HPV5, may establish infections and persist for a lifetime of the individual without ever manifesting clinical symptoms. Types 1 and 2 cause common warts. Types 6 and 11 are associated with genital warts and laryngeal papillomatosis and are considered low risk for cancer. There are 15 carcinogenic serotypes. 70% of HPV cancers are caused by serotypes 16 and 18. Serotypes 31, 33, 45, 52, and 58 cause 15% of female cancers and 5% of male cancers. Red serotypes are those covered by the 9-valent vaccine Gardasil 9. Most HPV infections are asymptomatic. 70% of HPV infections resolve within 1 year and 90% within 2 years. Genital warts are the most common clinical manifestation of HPV in the United States, resulting in about 360,000 cases per year. Juvenile recurrent respiratory papillomatosis is rare, but seen in infected infants post-delivery. HPV infection is associated with intraepithelial lesions of the cervix, vagina, vulva, and anus. A pap smear is used to detect lesions, particularly precancer and cancer in the cervix. Fortunately, many precancers clear spontaneously. A major concern is cancer for those individuals who have persistent HPV infections. This table provides HPV prevalence data from the National Health and Nutrition Examination Survey, NHANES, from 2011 to 2014. Adults 18 to 69 have an HPV serotype genital infection prevalence of 40 to 45%. One half of the HPV viruses found in this population are of high-risk serotypes that can lead to cancer. The prevalence of high-risk HPV serotypes in the oral cavity are higher in males, 6.8%, versus females, 1.2%. Human papillomavirus, HPV, is so common that the CDC stated that nearly all sexually active men and women get the virus at some point in their lives. A 1999 survey of students indicated that approximately 40% of ninth graders, 13-year-olds, across the United States reported having had sexual intercourse, with that percent rising with each subsequent grade. Males were more sexually active than females at each of the grade levels. There was a higher percent of onset of sexual activity in these age groups among African American and Hispanic youth versus white adolescents. The CDC's Advisory Committee on Immunization Practices, ACIP, recommends routine vaccination of all children at 11 to 12 years old, since this will reach most but not all children before onset of sexual activity. The HPV vaccine Gardasil 9 can be given as early as 9 years old as licensed. Use at 9 years of age would particularly apply to children with a history of sexual abuse. Challenges to address STDs include limited resources, a crumbling public health infrastructure, resulting in reduced STD programs and screenings, treatment, prevention, and partner services, long-standing social and economic factors like poverty, lack of health insurance, healthcare access, and inadequate STD public knowledge. Prevention includes early screening and treatment of infected individuals to decrease transmission for chlamydia, gonorrhea, and syphilis. Vaccination of children at 11 to 12 years old is the best prevention for HPV. The most common missed opportunities for preventing congenital syphilis was lack of timely prenatal care and syphilis testing, along with not providing adequate maternal treatment despite receiving a syphilis diagnosis, often due to inadequate follow-up. What can be done to enhance screenings, treatment, and HPV vaccinations? Enhance access by establishing local community clinics. Engage communities and horizontal communicators. Community horizontal communicators are uniquely situated to promote STD prevention at the local level and empower individuals to prioritize their sexual health. Industry and private sector research for innovations in STD testing, treatment, and vaccines is needed. Healthcare providers should better integrate STD prevention and sexual health into their routine practice. Public health must prioritize, develop, and implement STD prevention and surveillance programs that include disease investigation, contact tracing, STD training, community engagement, and the organization of STD coalitions. Tuberculosis, TB, is caused by a bacterium called Mycobacterium tuberculosis. The bacteria usually infects the lungs, but can also infect any part of the body, like the kidneys, spine, and brain. If not treated properly, TB disease can be fatal. An individual infected with TB can manifest two conditions: latent TB infection, LTBI, and TB disease. Latent tuberculosis infection is when a person is infected with Mycobacterium tuberculosis but does not have active tuberculosis or TB disease. An individual with TB disease is contagious, while latent tuberculosis is not. About 5 to 10% of individuals who do not receive treatment for latent TB infection will develop TB disease at some time in their lives. The TB bacteria is generally spread from person to person through the air when a person with TB lung disease coughs. TB case counts and incident rates have generally been steadily decreasing in the United States since 1992. The TB incidence in the U.S. in 2022 was 2.5 per 100,000. It's estimated that up to 13 million people in the U.S. have latent TB infection. The rate of TB disease in American Indians and Alaska Natives was 4.3 cases per 100,000 population, which is over 8 times higher than the rate of TB disease in non-Hispanic whites at 0.5 cases per 100,000. In 2021, 88.1% of the TB cases reported in the United States occurred among racial and ethnic minority groups. The percentage of TB cases occurring in non-U.S. born persons was 71.4% of the national case total in 2021. Control and elimination of TB in the U.S. depends on timely diagnosis of latent TB, LBTI, and TB disease, active TB, by skin test or blood tests, for example, quantiferin TB Gold, T-spot, and treatment of both latent TB and TB disease. It's important to screen individuals at increased risk for TB even if asymptomatic. Treatment of latent TB is much easier than TB disease, since it usually requires one medication, where TB disease requires multiple medications. In summary, the National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention is particularly interested in engaging young people. HIV/AIDS prevention measures include antiretroviral therapy, pre-exposure prophylaxis, PrEP, post-exposure prophylaxis, increased use of condoms, and encouraging low-risk sexual behaviors. Vaccination is the best way to prevent hepatitis A and B. HBIG and hepatitis B vaccine is effective in preventing infection in the baby of a mother infected with hepatitis B. The best prevention for hepatitis C is to avoid risky behaviors like injecting drugs. Antiviral treatments can cure most people with hepatitis C. 4 of the most common sexually transmitted diseases are chlamydia, gonorrhea, syphilis, and human papillomavirus, HPV. Chlamydia, gonorrhea, and syphilis can be treated. HPV vaccine covers most HPV viruses that cause cancer. Control and elimination of TB in the U.S. depends on timely diagnosis and treatment of latent TB, LBTI, and TB disease.